This video we're going to talk about facelift incisions and what to expect. The reason we make incisions is because we have to access the tissues underneath the skin. The only way for us to get in there is with an incision. The other reason is that we are going to be mobilizing, we're going to be pulling on deep layers, which is going to then pull on the skin, and you'll end up with extra skin, and that skin needs to be removed. So access through an incision theoretically could be very small. You could make a small incision, you could work underneath the skin with cameras, but that doesn't solve the problem of what to do with all that extra skin once you've tightened everything. And so that's why the incisions are fairly long, is because we need to deal with that extra skin. It needs to be trimmed and needs to be put back together. It's kind of like taking in a dress. You know, you've got some extra material in some places, not enough in others, and you've got to make that material fit by moving it around a little bit. And so this is why we have to make incisions in and around the ear. The key to these incisions is to make them in places where they're camouflaged. So as an example, I would almost always make the incisions around the hair just at the edge of the temporal hairline. So in men, with sideburns, you can make that a little lower. In women, they have a fairly defined temporal hairline. The incisions can be placed within the hairs so that after the procedure, when they're healing, the hairs will grow through the incision and help to camouflage that. They do then extend in front of the ear, and often people tell me, well, why don't you put it behind the ear? Well, the reason is that we want the ear to stay where it is. If we put it behind the ear and lift the ear and the face up and move all of that up, we'd be removing the ear. So the incisions have to go in front of any of the structures that you want to stay. So we put it in front of the hair so that the hair doesn't move. We put it in front of the ear so that the ear doesn't move, and the same thing in the neck. There's lots of little nooks and crannies. There's junctions between the earlobe and the cheek. There's a groove behind the ear. These are all great places to hide an incision. And for the most part, if you look really closely at that skin, you can see where the incision is. But often, from a reasonable distance, or even your hairdresser, once the incisions have healed, they're very difficult to see. And some patients, of course, will heal more quickly than others, but the general principle of placing the incisions in areas that are going to be well camouflaged is the key. Making a shorter incision doesn't necessarily mean it's a better incision. We want the incisions to lie flat. We want to hide them where you can't see them, and the length of the incision isn't really an indication of whether or not it's going to be well camouflaged. So it's important to make them long enough that you're going to get the result that you want. And I think I recommend for most patients, I just show people before and after photos of scars that they can barely see. And I just encourage them to let me do what I think is going to work best for them and not really worry too much about the scar, as it's usually a non-issue.